What if the system deciding your diagnosis isn't human? What if it processes your symptoms faster than any doctor, yet still misses something critical? AI is already in hospitals, clinics, and your phone. It scans, predicts, and suggests treatments in seconds. It feels like the future of medicine. But the real question isn't what AI can do. It's what happens when we stop noticing when it's wrong. And today, you'll see how AI is already shaping healthcare and why that safety may be an illusion. By the end, you'll understand the one risk almost no one is talking about. AI is good at one thing: patterns humans miss. Early signs of cancer in scans, irregular heart rhythms, small shifts in breathing or behavior. A doctor sees dozens of cases a day. AI sees thousands. It doesn't get tired, doesn't lose focus, doesn't hesitate. In hospitals, that speed already saves lives. It flags risks earlier. It prioritizes urgency in seconds. But speed isn't understanding, and that's where it starts to break, quietly, when confidence grows faster than accuracy. AI doesn't actually know what it's looking at. It doesn't understand illness the way a human does. It works by comparing patterns from past data, and that creates a hidden weakness. If the data is incomplete, the result is incomplete. Some systems are trained on limited patient groups, which means they work better for some people and worse for others. A model trained on one population may struggle with different conditions or demographics, but the system doesn't see this limitation. It just follows what it has learned. So the same tool that detects disease early can miss it in someone else, not because it's broken, but because reality was only partially shown to it. And this gap stays invisible until the moment it matters most, until a decision depends on it, until someone assumes it cannot be wrong. Now consider how decisions are made. AI doesn't just assist anymore. It influences outcomes. Which patients are marked as high risk? Which treatments are suggested first? Which cases get immediate attention? These suggestions directly shape real medical actions. But here's the critical issue. Many systems don't explain how they reach conclusions. Even doctors can't always see the reasoning. It becomes a black box. You get an answer, but not the logic behind it. And that changes everything. Because what you can't see, you can't really challenge. Over time, this shifts behavior. Not suddenly, but gradually. Trust starts replacing verification, and at some point, trusting the system feels more natural than questioning it. That shift is subtle, but powerful, and once it happens, control doesn't feel taken away. It feels normal. Let's talk about your data. Every diagnosis, scan, and test result becomes part of a system. AI needs massive data sets to improve, so healthcare systems collect more information than ever before. Your medical history, your habits, your risks, data from wearable devices and health apps, even patterns of behavior over time. This data is extremely valuable, not just for treatment, but also for research, development, and technology companies. And once your data is stored, control becomes unclear. Who owns it? Who can access it? Who is responsible for protecting it? Healthcare data breaches are already happening, and AI only increases the scale of what can be collected, stored, and shared. The more powerful the system becomes, the more valuable your data becomes, and the less visible its movement becomes. You rarely see where your information goes after it's used, or how long it continues to exist inside systems, or how many connected systems quietly learn from it over time. Here's where the shift becomes harder to notice. doctors begin to rely on AI recommendations. At first, it's support, then it becomes guidance. Over time, it turns into dependence. This doesn't happen suddenly, it happens quietly, because the system works well, most of the time. So fewer decisions get questioned, fewer results are double-checked, more trust shifts toward automated conclusions. You've seen this pattern before. When something becomes efficient, people stop paying attention to how it works. And that changes decision-making, not by replacing humans, but by slowly reducing the role of critical thinking in the process. And once that shift happens, reversing it becomes difficult, because the system still feels reliable, even when it isn't perfect. And perfection is never required for trust to grow, only consistency is. Now the part most people don't expect. AI doesn't need to be wrong to cause harm. It only needs to be trusted too much. Even highly accurate systems still make rare mistakes. But when humans stop verifying, those rare mistakes turn into critical failures, because no one is actively checking anymore. This is the hidden risk, not obvious failure, but silent overconfidence. And in healthcare, that difference can decide outcomes. One unchecked recommendation can delay treatment. One missed signal can change a diagnosis, not because the system completely failed, but because no one questioned it when it mattered. And that risk grows with every improvement in technology, because the better it seems, the less people doubt it, and the less they stay alert, until attention is no longer required, and mistakes become harder to see. So where does that leave you? AI can absolutely save lives. It can make medicine faster, smarter, and more precise, but it also changes how decisions are made and who ultimately influences them. The question is not whether AI should be used. It already is. The question is how much you trust it and how much you still question it. Because the future of healthcare is not just about better technology. It's about whether humans remain in control or slowly step back. And that shift is already happening, quietly, inside systems most people never see. Right now, while everything still feels normal, before the change becomes impossible to notice, before trust fully replaces awareness, before the system becomes something you simply follow without thinking. This is where things start to shift quietly, not because AI becomes perfect, but because it becomes trusted without question. We start using it not just as a tool, but as an answer. Faster decisions, easier choices, less doubt, and slowly, without noticing it, we stop pushing back, we stop verifying, we stop challenging. This is the risk most people never talk about. Not that AI makes mistakes, but that people stop questioning it. And the moment that happens, control doesn't disappear. It simply changes hands. Technology is already shaping how you think, but the next step is more subtle. It may decide what you remember and what abilities quietly fade away. I'll show you in the next transmission. Event classification, medical augmentation, causation source, data-driven analysis, control status, stabilizing. Monitoring continues.